So the functional limitation in Nagy model is similar to dash in ICIDH. Option B is correct, disability. The next MCQ is the finger pressure massage method called shiatsu is dash. Option A is correct, Japanese. The finger pressure massage method called shiatsu in Japanese. So the next is when the piezoelectric crystal change shape, the parameter produced is option B is correct, frequency of the waves. The fright and flight response is an example of option C is correct, respondent behavior. In hydrotherapy, the factors which have an effect on heart rate are option C is correct, both temperature and water. They both have an effect on the heart. So the next MCQ is direction seen under the cathode when a direct current is passed through it is option C is correct, alkaline direction. For hypoxaemic patient, which position will you prefer? Option D is correct, prone, abdomen free. All of the following are signs and symptoms of a shoulder dislocation except option D is correct, definite sensation of crepitus. When massaging the lateral head of the fibula, of which structure should you be careful? Option B is correct, peroneal nerve. A physical therapist examines an 80-year-old male patient in an outpatient clinic. Before doing his patient interview form, the therapist noticed that the man is well-chested. On the basis of these physical observations, in what organ system does the therapist expect to see dysfunction? Of course, spiral-shaped chest है, sternocleidomastoid muscle जो है वो involve है, so option D would be the right answer, pulmonary system. The following handicap is not eligible for job reservation in central government for C&D post. None of the above. Option D is correct, none of the above. The next MCQ is fluorotherapy contains. Option D is correct, mass of tiny cellulose particles suspended in moving air. So the next MCQ is a physician has ordered a specific type of electrical stimulation that utilizes a frequency of 2500 Hz with a base frequency at 50 Hz to achieve fused tetany. Which type of electrical stimulation has the physician ordered? Option D is correct, Russian stimulation. So the next MCQ is the term Russian current applies to stimulators. Option C is correct, which modulates a continuous sine wave. Physical therapist has chosen iontophoresis for pain management and decreased inflammation in a patient with lateral epicondylitis. Iontophoresis is an example of which type of electric current? Option B is correct, direct current. Person with quadriceps weakness walks with equinus gait, correction of which option A is correct, will lose the independent ambulation. And the next MCQ is complete disappearance of shadow of lesser trochanter in anterior posterior view of X-ray indicates. Option C is correct, posterior dislocation of hip. The law that gives reciprocal relationship between the distance and intensity from the source to surface is option B is correct, inverse Kerr law. Flexion of elbow is associated with is correct, inferior glide of ulnar and superior glide of radius. Statement is false. Option D is correct. HPVC has a single monophasic waveform. The next MCQ is increase in torsion angle of femur is referred to as option C is correct, anteversion. A current that produces great muscular hypertrophy with gain in strength is option C is correct, Russian current. The following bone is a pneumatic bone. Option C is correct, maxilla.